Hi everyone, welcome back to the channel. I'm so happy to see you here again. Your continued support means the world to me. Did you guys know about dementia? Dementia is a progressive neurological disorder that impacts cognitive function, behavior, and the ability to carry out daily activities. Unfortunately, dementia often creeps in quietly, making it easy to miss the early warning signs. Most people associate dementia with memory loss as the primary symptom. But what if the warning signs are far more subtle? Early signs might include changes in mood, difficulty finding the right words, or trouble completing familiar tasks, things that are easy to overlook but can be crucial indicators. However, catching these symptoms early is crucial for effectively managing the condition. In this video, we'll uncover 8 early, often overlooked symptoms of dementia that you might not realize are linked to the disease. Stick around to discover which common habits and behaviors could be signaling something more serious. You'll be surprised at just how easily these symptoms can blend into daily life. Now, without any further ado, let's get to it. Number 1. Memory loss. Almost all of us have a few forgetful moments from time to time. This is normal and can be due to a variety of reasons. However, what is alarming is when these forgetful moments start affecting your day-to-day life and become described as memory loss. Memory loss is often one of the earliest symptoms of dementia. This is because the hippocampus, a key brain region involved in forming and retrieving memories, is one of the first areas affected by dementia. In Alzheimer's disease, for instance, abnormal protein deposits and cell damage begin in the hippocampus, leading to difficulties with new memory formation and recalling recent events. In addition to affecting the hippocampus, dementia causes the death of brain cells, leading to a reduction in the brain's overall ability to process and store information. In a study published in Journal of Neuropathology, researchers examined brain tissue samples from individuals with late-onset dementia. Focusing on the hippocampus and other memory-related regions, they found significant hippocampal atrophy in 85% of the samples. Amyloid plaques and neurofibrillary tangles were prevalent in these regions, correlating with the degree of memory loss. Number 2. Difficulty performing familiar tasks. If you struggle with tasks they previously performed with ease, such as cooking, driving, or managing finances, then you may be suffering from a warning sign of dementia. This occurs due to the affection of the cerebral cortex. This is the area in the brain responsible for higher-level brain functions, such as planning and performing tasks, and it shrinks because of dementia. Moreover, dementia affects the brain's executive functions, impairing the ability to organize, sequence, and complete tasks that were once routine. To study the effect of Alzheimer's disease on daily tasks, 200 patients with early-stage Alzheimer's were followed over 5 years, through which their ability to perform daily tasks was assessed. By the 3rd year, 70% of participants had significant difficulty with at least 2 daily tasks, such as managing finances and cooking, correlating with cortical shrinking observed through MRI scans. Number 3. Confusion about time and place. People with dementia may lose track of dates, seasons, and the passage of time, They may also become disoriented in familiar places. For example, a person might forget the current year or get lost in their own neighborhood. In dementia, the temporal lobes, involved in processing sensory input and establishing context for events, can be compromised. This leads to confusion about dates, times, and locations. This is supported by evidence in a journal called Alzheimer's Research Therapy 2010. Here researchers assessed 100 patients with varying degrees of dementia on their ability to recognize dates, times, and navigate spaces. The results showed that 65% of patients with moderate dementia showed significant disorientation, with corresponding temporal lobe dysfunction observed in MRI scans. Number 4. Poor judgment. An often shocking symptom of dementia is poor judgment in financial matters, personal safety, or social situations. A person might fall victim to scams, dress inappropriately for the weather, or engage in risky behaviors. This can be attributed due to the degeneration of the frontal lobe due to dementia. The frontal lobes are essential for decision-making, problem-solving, and judgment. When 120 patients with Alzheimer's were evaluated using neuropsychological tests and frontal lobe imaging, 75% of patients exhibited poor judgment and decision-making abilities. Furthermore, imaging revealed substantial frontal lobe shrinking. Number 5. Changes in mood or personality. Another symptom of dementia is having changes in mood and personality. A previously outgoing person might become withdrawn and lose interest in social activities. The limbic system, which regulates emotions, is often affected by dementia. Changes here can lead to mood swings, increased irritability, anxiety, depression, or a shift towards apathy and withdrawal. And not only that, but dementia can also alter levels of chemicals like serotonin and dopamine, contributing to mood and personality changes. In a study, researchers conducted post-mortem analyses of 80 individuals with dementia. They found significant limbic system degeneration in 70% of cases with documented mood changes, such as increased anxiety and depression. Number 6. Problems with language. This symptom manifests as having trouble finding the right words or following and joining conversations. For instance, a person might substitute incorrect words or pause frequently while speaking, searching for the correct term. This occurs as a result of damage to Broca's and Wernicke's areas, which are the regions of the brain responsible for language production and comprehension. Dementia can lead to degeneration in these areas, causing difficulties in finding the right words or following conversation. Adding to that, dementia can erode the network of knowledge about the meanings of words and objects, leading to a reduced ability to communication effectively. In 2006, a study involved 150 patients diagnosed with either Alzheimer's or vascular dementia. They underwent comprehensive language tests and brain imaging. According to the results, 60% of Alzheimer's patients and 45% of vascular dementia patients showed marked impairment in language production and comprehension, linked to damage in Broca's and Wernicke's areas. Number 7. Difficulty understanding visual or spatial relationships. Part of the brain called the occipital lobe processes visual information. Destruction to this lobe as a consequence of dementia can impair the ability to interpret visual signals, affecting spatial awareness. When dementia disrupts the integration of visual and spatial information, it makes it hard to judge distances or navigate space. In a study that explored the prevalence of this symptom among dementia patients, 55% out of 130 patients exhibited significant visuospatial deficits. This was due to the damage to the occipital lobe and other related regions. Number 8. Misplacing items. The part of your brain involved in spatial orientation and object recognition is the parietal lobe. The affection of this region, combined with the memory impairment caused by dementia, can lead to frequent misplacement of items and difficulty remembering where one has placed objects. In 2013, in the Journal of Alzheimer's Disease, a study was published titled Spatial Memory and Alzheimer's Disease. In this study, researchers assessed 100 Alzheimer's patients on tasks requiring spatial memory and tracking object placement. Out of these 100 patients, 65% had difficulty retracing steps and locating misplaced items. This was further supported by the shrinking of their parietal lobes seen in the MRI. Understanding these symptoms and their underlying causes can help in early detection and management of dementia. Now we want to hear from you. Have you ever experienced any of these symptoms? If so, which ones were they? Thank you for being here. If you enjoyed the video or found it useful, hit that like button and share it with someone who could benefit. Every bit of support helps.